Welcome, everyone. Thank you for joining us in the Humber, Guelph Humber, Addressing Substance Use and Misuse. We're presenting Know the Facts and Risks Saving Lives. This is presented from Student Wellness and Accessibility, the health promotion team, which consists of myself, Stephanie Santorsola, and Simran uh, Carr. And we welcome you to the presentation. Thank you. Next slide, please.
Okay, so the information and the content of this presentation is for the general purpose. The content is not a substitute for or seeking any appropriate medical care, resources, and support. All the information and content is provided as the serving purpose for the generalized information only. The information and content in the presentation may be sensitive. There is a growing agreement in Canada that problematic substance use is a health issue that can be prevented. Problematic substance use is an ongoing public health and safety concern in Canada. It's hoped that talking and addressing substance addiction and misuse can raise awareness and save lives. If you or someone you know needs support or assistance, please contact our program chair, our Student Wellness and Accessibility Center, or any community resources, both within the campus and external. In any life-threatening situation, always call 911. So why it is important to address substance use and misuse? There is a growing agreement in Canada that problematic substance use is a health issue that can be prevented. Problematic substance use is an ongoing public health and safety concern in Canada right now. According to the Government of Canada, approximately 1 in 5 Canadians aged 15 years and older experience a substance use disorder in their lifetimes. Drinking excessively can have both short-term and long-term negative effects. These effects can be alcohol poisoning, impaired judgment, unintentional injuries, violent behavior, and can even lead to depression, liver damage, and increase your risk of heart attack and disease. Canadians use alcohol most commonly. Almost 4 million Canadians aged 15 years or older reported that they used at least one illegal substance in 2017. Some examples of these illegal substances can be cannabis, cocaine, heroin, etc. Canadians use cannabis the most. The higher proportion of youth aged 15 to 19 and young age adults use cannabis more as compared to adults of age 25 or older. In the recent years, the potential harm from illegal drug use have been made worse by a supply of that's often contaminated. The opiates like fentanyl have synthetic opiates in it, which is fatal for life. There were 1,337 opiate-related deaths in Ontario between July 2017 and June 2018. Most of these deaths were deemed to be accidental according to the Public Health of Ontario. By talking about it and raising awareness about the substance use, addiction, and misuse, we all can become better informed and can make appropriate choices to save lives.
Alcohol is the most commonly used substance in Canada. Understanding the impacts of alcohol use is essential to minimize the risks and harms. We're not saying to avoid alcohol, rather, we're wanting you to understand it, understand what constitutes a drink, what is considered binge drinking, and what can be concerning. Remember, binge drinking is having many drinks on one occasion. So, for example, 5 or more drinks for a male, or 4 or more drinks for a female. And we have included in this page what is considered a drink, as a drink is dependent on the amount and type of a drink. Therefore, a shot which is 2 ounces, is the same as a full bottle of beer. If you do decide to drink, great. Perhaps, though, consider low drinking and drinking in modification and ensure safe drinking. There are resources and pamphlets that we will share at the end to provide you further information. Next slide, please. Intoxication affects your judgment, your attitude, your behavior, and your reflexes. People do all kinds of things when they're drunk that they would never dream of doing when they are sober. And people are less inhibited when they're intoxicated, they're more reckless, careless, and maybe they're not making the right choices. And again, we're not advising not to drink. What we're saying, safe drinking, drink in low drinking and drink in modification. So respect and understand drinking. What we're trying to really promote and encourage is to recognize what binge drinking is and the detrimental effects of binge drinking. And when you binge drink, your risk of many safety and health problems increase. These include misjudging a situation or what is being said. You can get into fights, possibly getting even assaulted, having unwanted sex, or being pushed into unwanted sex on others. There's potential of developing or worsening depression, anxiety, or other mental health concerns, having blackouts. When you lose all memory of where you were and what you were doing while you were intoxicated or drunk, having a hangover that could be including headache, shaking, vomiting, definitely, sometimes feeling quite sad, quite depressed, that seeing suicide as a way out when you're feeling really down. Individuals can get injured or even killed while driving, biking, boating, or snowmobiling, or even being a passenger in any of those motor vehicles. There are a lot of potential injuries that can occur with binge drinking and being intoxicated. And over the long term, repeated binge drinking can also increase the risk of damage to your stomach, pancreas, liver, and brain. You can develop cancer. There could be development of an addiction to alcohol. And binge drinking also increases your risk of arrest and other legal problems. In addition to that, there's also the concern, and aside from binge drinking, is alcohol poisoning. And what alcohol poisoning is, that's caused by too much alcohol within your body. And that could be extremely dangerous, and that can lead to coma and death. Some signs of alcohol poisoning can include being disorientated or confused, passed out, and not being able to be woken up, having slow, irregular breathing, blue or pale, cold, clammy skin, slow heart rate, vomiting while passed out. That having alcohol poisoning is extremely dangerous and it is a medical emergency. If you suspect anyone having alcohol poisoning, it is immediately calling 911. Next slide, please.
Cannabis. Cannabis is a psychoactive drug that is used for the recreational and medical purposes. How cannabis affects you depends on several different factors, such as how much you use, how often and how long you used it, whether you smoke, vape, or eat it. This amplifies your mood, and it also depends on the age, your mood, your expectations, and the environment you are in. People can have very different experiences with cannabis. Some may feel relaxed, lively, talkative, and even others may feel tense, anxious, fearful, and confused. The kind of experience you may have vary from one drug taking episode to another, usually between the amount taken and the method used and the frequency of irregular cannabis use. Those who use cannabis should be aware of the health risks and take measures to avoid them. The following health risks are possible for anyone who takes cannabis heavily and regularly. These health risks can be problems with thinking, memory, or physical coordination, impairment, which can lead to serious injuries such as car accidents, hallucinations such as seeing, hearing, tasting, smelling, or feeling things differently that doesn't exist in real. Mental health problems, especially if you or an immediate family member has had a mental health issues or can be addiction to alcohol or other drugs. With the long-term use, the person can develop cannabis dependency. It can cause breathing and lung problems from smoking. It can, in worst cases, if it's taken regularly in a heavy amount, can cause cancer from smoking. It also is possible for causing problems during or after pregnancy, especially if the cannabis is smoked. Some illegal drugs. Different types of drugs affect your body in different ways. The effects associated with drugs can vary from person to person. How a drug affects an individual is dependent on a variety of factors. These factors can be your body size, general health, the amount and strength of the drug, and whether any other drugs in the system are present at the time when you're taking these drugs. Drugs can have both long-term and short-term effects. These effects can be physical, psychological, and can also cause dependency. So it's important to remember that there is no safe level of a drug use. Let's discuss cocaine in detail. So cocaine is a highly addictive drug. It can overstimulate the heart and nervous system and can lead to seizure, stroke, or heart attack. It helps in reducing the pain perception and may result in injury. It carries greater risk if mixed with alcohol or other stimulants, especially if you have a high blood pressure or if you have a pre-existing heart condition. It can cause a harm to your baby during pregnancy and may cause miscarriage. It also increases the risk of carrying mental health issues like anxiety and psychosis. If it's snorted, it can cause damage to the lining of the nasal passage and nose. If it's injected, it can cause brain collapse, increase the risk of HIV and hepatitis infection. MMDA can make sound and colors seem more intense, may cause anxiety, confusion, and even psychosis. The long-term length, the long-term use is linked to the memory loss, depression, and anxiety. It can also lead to overheating and dehydration of the body. It tends to stop your body producing enough urine, which leads your body to retain fluids. So the drug abuse and addiction can affect almost every system in your body. You probably know that drugs affect feelings and moods, judgment, decision making, learning, and memory. But they can also cause and worsen other health problems like cancer, heart diseases, lung diseases, liver infection, mental health disorder, and infectious diseases like HIV, AIDS, hepatitis, and tuberculosis. Some of those effects occur when drugs are used at a high dose or after prolonged use, but some may also occur just after 1 year. So the key point to remember here is all the drugs have a negative health effects, and these negative effects can also lead to death in some cases.
In 1995, NASA conducted an experiment to see the toxicity and effects of drugs on spiders. Spiders typically spin webs by producing silk from their silk glands with the help of their spinnerets, which are special organs that allow them to decide what type of thread they need at various points. The NASA researchers found that the more deformed the web looks compared to a normal web, the more toxic the chemical is. So we're just going to discuss a few of these webs here. The first web, that's a normal web on the left next to the web made by a spider on LSD. And LSD It's an illegal semi-synthetic drug that combines natural and man-made substances. And LSD can cause changes in thought, attention, perception, and emotions. And these alterations appear as hallucinations. The danger of LSD is the unpredictability of it. When we look at the other web, that's a spider web made while the spider was exposed to marijuana. And spiders were easily sidetracked while building, and they left their webs unfinished when they were on marijuana. And marijuana has both short and long term effects on the brain. It may impair thinking, memory, learning functions, and brain development. And the physical effects include breathing problems, nausea, and vomiting. And as Simran presented in previous slides, there are a lot of pregnancy concern with being on marijuana or cannabis with respect to healthy child development during a pregnancy. When we look at the other um, web, this is a web made by a spider exposed to sleeping pills. And the spiders gave up on their webs even faster than the ones who had a little of cannabis or marijuana, because sleeping pills, that's a sedative that's used for the short-term treatment of insomnia. And sleeping pills can cause drowsiness, difficulty focusing, attention deficit, and unsteadiness. The last web that we'll talk about is the spider web made by a spider exposed to amphetamines. And these webs had large gaps as the spiders weaved them energetically without planning or attention to detail. And amphetamines, they speed up the heart rate. There's impaired judgment, increased respiratory rate. And this experiment really highlights the effects of drugs, substance misuse has on spiders. Imagine the effects that it has on individuals. Um, so, what's really important to recognize is substance misuse can cause detrimental effects on your health and wellness, but also it can impact friendships, relationships. It can lead to depression and anxiety and other mental health conditions. Next slide, please.
So, Canada is in the midst of an opioid crisis right now. There were more than 11,500 apparent opioid-related deaths between January 2016 and December 2018. These lost lives make the opioid crisis a leading concern for health and safety of public health. Opioids exist in both illicit and illicit forms. The variety of opioid medications such as fentanyl, morphine are produced and used most often to treat pain. People consume these products for medical and non-medical purposes. Unlike other medications like antibiotics, opiates are psychoactive substances. This means that they affect your mind, mood, and mental process and can induce the feeling of being high. This creates the potential for them to be used improperly. Most of the harm currently being experienced due to fentanyl, a synthetic opioid that can be prescribed to patients or acquired illicitly. The presence of fentanyl in other substances dramatically increases the risk of overdose as it is extremely potent drug that can cause fatality even in the trace amounts. So why fentanyl is so dangerous drug? Fentanyl is a dangerous drug because it is 20 to 40 times more potent than heroin and 100 times more potent than morphine, which makes the risk of accidental overdose very high. There is no way to know how much fentanyl has been mixed into illegal drugs because you can't see, smell, or taste it. Consuming as little as a few grains of salt worth of fentanyl can kill you. There are a variety of opiate medication, including codeine, fentanyl, morphine, often used to treat pain. Opiates belong to a group of drugs known as depressants. So what depressants do is slow the activity of the brain and the body and decrease the urge to breathe, resulting in less body oxygen and driving the body organs out Driving the body organs of oxygen can lead to death. Majority of the opioid harm or crisis is called fentanyl. It is an extremely potent drug and can be fatal, particularly when it is used with other drugs. Fentanyl is made and mixed, which makes it other drugs. When fentanyl is made or mixed with other drugs, it makes this eventually dangerous. So some facts about opioids in Ontario. The opioid crisis had brought to light the devastating effects of opioids are having on individuals, families, and communities across Canada. Since 2016, there have been more than 9,000 apparent opioid-related deaths. In 2017, approximately 11 lives were lost each day because of the opioid overdose. Many others have been hospitalized because of the opioid overdose. Nearly 94% of the opioid overdose deaths happen by accident. The young Canadian aged from 15 to 24 are the fastest growing population acquiring hospital care from opioid overdose. Nearly half of the deceased persons were alone at the time of the accident. So naloxone can be temporarily used to reverse the effects of an opioid overdose. Naloxone wears off within 30 to 90 minutes, so it's very important to seek the medical attention as soon as possible. Always remember, if you suspect any overdose, call 911 immediately. So, what are some signs or symptoms you can recognize the opioid overdose? Opioids affect how your brain controls your breathing. If you take more opioids than your body can handle, this will start to show signs and symptoms of overdose, such as slow, weak, or no breathing, blue lips or nails, dizziness or confusion. If you're trying to wake the person, that person is not responding or not waking up, choking, or difficulty in staying awake. Some other signs can include vomiting, not responding to the noises. So, in the cases when you suspect any of these symptoms, immediately call 911 and seek a medical assistance.
Naloxone is used in an opioid overdose, and it only works if the person has opioids in their system. Naloxone is a fast-acting drug used to temporarily reverse the effects of that opioid overdose, and it can restore breathing within 2 to 5 minutes. Naloxone is active in the body for only 30 to 90 minutes, but the effects of most opioids can last longer. And this means that the effects of naloxone are likely to wear off before the opioids are gone from the body, which can cause breathing to stop again. An overdose is always an emergency. Even if naloxone has been administered, always call for help. Remember, naloxone only works if there's opioids in your system. It does not work for all drug overdose. There are a variety of naloxones out there. There's the naloxone nasal spray that is sprayed directly into the nose where it is absorbed. It starts to take effect in about 2 to 3 minutes. The injectable naloxone, that's injected into a muscle in the body, possibly the upper arm, thigh, or buttocks are the best, and that usually takes effect in about 3 to 5 minutes. There are free naloxone kits that are available. However, you definitely need to be trained to recognize an opioid overdose and how to use the spray kit properly. Definitely with naloxones, they do have expiry dates, so always check the expiry date. And you can always return expired and unused kits to the local pharmacy. We want to prevent unintentional opioid deaths. Next slide, please. Witnessing an overdose can be very scary as the person's breathing becomes weaker, shallower, and it can even stop completely. Overdoses are medical emergencies. Staying at the scene to help can save someone's life. If you've taken drugs or have some on you. You are protected from simple drug possession charges by the Good Samaritan Drug Overdose Act. And this law applies to the person who seeks help and anyone else at the scene when help arrives. The important thing is, don't panic. It's okay. Let's get the help to the individual who needs the help. And Humber College does have a suspected opioid overdose response policy enacted in November of 2018. And the college will ensure the appropriate training is provided to designated employees to administer naloxone nasal spray as an emergency life-saving measure to a suspected opioid overdose. And the college will ensure the appropriate and ongoing supply of naloxone nasal spray is stored in various designated locations. And also, the college has designated employees that are trained to administer naloxone nasal spray and will respond to a suspected overdose in accordance with the suspected opioid overdose response procedure to preserve life. And that's the bottom line. We want to preserve life. So if you witness someone, you're there with them, please seek help immediately. So, what can you do if you want to stop drinking but you can't and it's becoming a problem in your life? Ask for help. Start by telling your trusted friends and family members you want to cut down or stop drinking and ask them for their support. Ask them to possibly organize activities that don't involve drinking. And definitely seek professional help from a respected organization. We've listed two organizations that can provide some assistance. There's the Center for Addiction and Mental Health, CAMH. They have a variety of programs available to assist with any type of substance use or misuse. As well, Clonics Ontario, it is the large umbrella group that has a variety of resources within the province that they can provide you within your specific geographical area. That way you can get the professional help and support that you need. Additionally, Humber College does have all their resources available virtually during this pandemic. So please seek out, access the We Got You website, access the Humber resources. They're readily available and they can help connect you to support resources both on campus and off campus to ensure your health and wellness. The important thing is recognize that there might be a concern, ask for that help, ask for the support. We're all there to provide you with the guidance and the support. Because remember, we got you, we still got you in this pandemic, and we're there for you. We want you to thrive and succeed. Next slide, please, Simran.
So these are some online resources that you can use to obtain some more information on this topic.
And thank you for listening to our presentation. Feel free to always reach out to Student Wellness and Accessibility should you have any further questions or concerns. Remember, be safe. Thank you.